Are there many pain medications over the counter?
There are.
Do they all have their problems?
They all have problems.
They all work?
They all work.
Yeah, and so I tell people there's no free lunch. And so every time you take a medicine, there's a potential side effect. So if I came to you and I was having just headaches, non-pounding, non-migraine, just non-specific headaches, tension headaches, which medicine would you use?
Well, that's a great question. So I would personally use a leaf, but I wouldn't use it on a regular basis because, like you said, any medication has a downside to it. And if you had daily ingestion of one of these NSAIDs, it can actually cause the headaches to continue. So I would use a leaf today, but maybe tomorrow I would use Tylenol.
If I was a runner and my knees were hurting and they got stiff in the morning and my feet were all stiff, which one of those would you use?
Yeah, well, I think generally most people should start off with Tylenol because it's the safest choice. But if that doesn't work, then try one of the anti-inflammatories. As long as you're not taking it on a regular basis, you should be okay.
What if your joints are hurting on a regular basis and you take ibuprofen type medication for a long period of time? The dangers you've already talked about, so you have to work that out with your doctor.
Absolutely.
Kidney function test and looking at the GI symptoms. So it gets pretty complicated. It's not just taking simple over-the-counter medications. Are there other over-the-counter medications for the stomach, for the allergies, for sinuses that we see when we go into the drugstore?
There are a lot.
And they don't have any free lunch, do they?
There's no such thing.